Good afternoon, dear students. Today we will explore a new topic, type roundworms. The class is actually roundworms, pathogens of Escherichiasis, enterobiosis, dracunculosis, filariasis, trichocephalosis, trichinelosis, spondyloidosis, hookworm, necatorosis. I am Andrei Pavlov, assistant of the Department of General and Molecular Biology. This slide presents lesson plan. First, characteristic features of the roundworms type organization, morphology, life cycle, pathogenic effect of human Escherichiasis, diagnosis and prevention of Escherichiasis. Third, features of the organization and development of pinworms, pathogenic effect, diagnosis and prevention of enterobiosis. Fourth, features of the structure and development of junior worm, pathogenic effect, prevention of dracunculosis. And fifth, morphology, life cycle, pathogenic effect of filaria, diagnosis and prevention of filariasis. Representatives of the type, more than 15,000 species, live in water, soil, decomposing organic substances. Many have adapted to the parasitic lifestyle of plants, animals, and humans. First, bilateral symmetry of the body, cylindrical or fusiform shape of the body. Second, the presence of a skin muscle, sac, and primary body cavity. Third, the presence of organ systems, nervous, digestive, excretory, and sexual. Separateness. Fifth, the appearance of the posterior intestine and anal opening. The type includes 5 classes. The class of roundworms proper is the medical importance. The weight of the female reaches 40 centimeter. The male 25 centimeter. Leaf presides white pink in color. The body is cylindrical, pointed at the ends. There are cuticular lips at the anterior end of the body. Escherichiasis, Escherichia is Jude Helmin. The human Escherichiasis is parasitic only in humans. Localization: a small intestine. It has no special fixation organs and is held in place due to the constant movement towards the current of food. They feed on food gruel. The female releases more than 200,000 eggs per day, which enter the external environment with feces. Fresh eggs are non-invasive. In a humid environment, in the presence of oxygen, a larva forms inside the egg. The maturation time of the egg, depending on the ambient temperature, is from 3 weeks. Temperature 20-30 cells to several months. Due to the thick multilayer shell, outer protein, middle glossy, inner fibrous. The egg is very resistant to external influence and retains its invasiveness for 37 years. A person gets infected through washed vegetables or dirty water, dirty hands. The invasive stage is the egg. Mechanical egg carriers can serve as flies, cockroaches. In the upper part of the small intestine, the larvae are released, enter the blood vessels of the intestinal wall. With the blood flow, they are brought to the liver, where they remain for 3-4 days. Then to the lungs. In the lungs, the larvae enter the lumen of the alveoli, where they grow and molt twice. After 10-15 days, the larvae extend through the airways into the pharynx. Some of them are released to the outside along with sputum, and some are swallowed and re-enter the small intestine, where they turn into adult escarids. Migration is associated with the need for oxygen for the development of larvae lasts 2 and 5 months. During the migration period, the larvae feed on blood. The lifespan of the ascaris in the small intestine is about a year. Pathogenic effect. Severe toxic allergic reaction, damage to the capillary wall and alveolar tissue during migration leads to minor hemorrhages in the lung tissue. Adult ascarids mechanically damage the intestinal walls, contribute to the attackment of bacterial infection and the development of dysbiosis. They cause the formation of pathological intestinal reflexes due to constant irritation of the intestinal walls. They absorb nutrients causing hypovitaminosis, depletion of the body. Clinic. With a small number of parasites, the disease is asymptomatic. Clinically expressed escheriasis occurs in two stages. The pulmonary stage of escheriasis corresponds to the period of larval migration and is manifested by coughing, chest pain, fever, often in combination with urticaria, skin itching. X-ray examination reveals volatile infiltrates in the lungs. The intestinal stage of the disease is caused by the presence of sexually mature escherichiasis in the intestinal lumen. Increases fatigue, weakness, headaches, abdominal pain, dyspeptic disorders. Children may have seizures. Complications of intestinal escheriasis, spastic intestinal obstruction, perforation of the intestinal wall with the development of peritonitis, appendicitis, extra intestinal localization of escherichiasis is associated with their high mobility. Most often, escherichiasis enter the liver, causing abscesses and mechanical jaundice due to blockage of the bile ducts. In distribes in penetration of escherichiasis into the larynx, nasal passages, which can lead to asphyxia, as well as the localization of escherichiasis in the paranasal sinuses of the nose and middle ear. Diagnostics. Clinical diagnostics is asthenic syndrome in combination with digestive disorders. Laboratory diagnostics is detection of larva in sputum, laroscopy, in the pulmonary period of the disease. More often it is an accidental finding. Ovoscopy of feces and serological reaction is ISC, RNGA, and REM. Prevention. Personal prevention is follow the rules of personal hygiene, thoroughly wash vegetables, use boiled water, protect food from flies and cockroaches. Public prevention is identification and treatment of patients, prevention of fecal contamination of the soil, wastewater treatment, improvement of toilets, disinfection of feces by composting, sanitary and educational work. It is forbidden to fertilize vegetable gardens with human feces. Pinworm Enterobius vermicularis, contact helminth, the causative agent of enterobiosis. The disease is widespread everywhere. According to the frequency of occurrence in ranks with amount helminthiasis in children. Morphological features is female body length is about 10 millimeter, male 2-5 millimeter, white color. At the anterior end of the body is the building cuticle. Vesicle and in the posterior part of the esophagus in a spherical expansion bulbous, involved in the fixation of the parasite to the intestinal walls. It is parasitic only in humans. Localization lower small intestine and upper large intestine. Infection usually occurs through dirty hands. The invasive stage in the egg. Pinworms attaches to the wall of the intestine with the help of a bulbous and vesicle. After fertilization, the males die. In females, after the eggs mature, the enlarged uterus squeezes the esophagus, the pinworms detach from the walls and descend into the lower parts of the colon. At night, during sleep, when the anal sphincter is relaxed, pinworms crawl out on the skin of the perineal area and lay eggs. At a temperature of 35 or 37 Celsius, and a humidity of 90% eggs become invasive after 4-6 hours. The crawling in pinworms causes excruciating skip itching. A person comes itchy places pinworm sacs fall under the nails and can be swallowed by patients. Therefore, also the life expectancy of pinworms is only about a month. A person can suffer from antibiosis for a long time. Retroinvasion is also possible. The exit of larvae from mature eggs in the perineal region and their migration through the anus to the intestine. Pathogenic effect is toxic and allergic. Damage to the intestinal mucosa and skin of the perineal area, and the addition of a secondary infection. The development of vulvovaginitis when pinworms crawl into the female genital tract. Clinic. It's mainly children who suffer. Characterized by itching in the perineal area, decreased appetite, nausea, constipation or diarrhea, abdominal pain. In sick children, sleep is disturbed, fatigue, headache, as well as epileptiform seizures and rhesus. Complication of enterobiosis can be appendicitis, paraparasitis, vulvovaginitis, and endometritis. Diagnostics. Clinical diagnostics is intestine skin itching in the perineal area, appearing at night, the detection of pinworms of the skin or in the feces. Laboratory diagnostics is otoscopy of scraping from perineal folds of or using the sticky tape method. A piece of transparent study cellophane tape with a sticky layer is applied to the skin of the perineal area and then to the slide. The study of enterobiosis is repeat the times at intervals of 2-3 days, helmintoscopy of feces with a high degree of invasion or diarrhea. Treatment with parenteral orally once or mebendazole 100 milligram orally. Prevention, personal prevention is compliance with the rules of personal hygiene. Public prevention is annual examination of children and staff in kindergartens, primary schools, careful observance of the sanitary regime in children's institutions, sanitary and educational work. Prevention of auto-invasion is sick child is very important. It is necessary to cut your nails short, wash your hands with soap in the morning after bedtime, bedline and underwear. Ironed the room is wet, cleaned daily. Junior worm, Dracunculus medinensis, biohelminths is the causative agent of dracunculosis. Foci of the disease are found in Africa, the Middle East, Southwest Asia, and South America. Morphology. The largest of the nematodes that parasitize humans. The sexually mature individual is filamentous, white in color. Late 70 or 120 centimeter with a white of 0.9 1 and 7 millimeter, male up to 3 centimeter. Viviparous, the larva is 0.65 and 0.75 millimeter long. The head end is rounded twice. The tail end is pointed. This slide presents life cycle of Dracunculus medinensis. Pathogenic effect, toxic allergic, tissue damage, and secondary infection. Clinic, the initial period of the disease migration is asymptomatic. At the site of localization of the parasite, edema and soreness of the tissues, itching of the skin, gradually develop. At this time, the temperature may rise or urticaria nausea, vomiting may appear due to the toxic and allergic action of the parasite. A bubble forms on the skin, which gradually increases in size. Then the swelling disappears. Under the skin, you can find a genial worm in the form of cord. The bubble of opened with the formation of rounded author at the bottom of which the head and the helmet is visible. Diagnostics. Clinical diagnostics is examination of the patient. Now, if the parasite has died and calcified, it can be detected by radioscopy. Laboratory diagnostics is usually not required. Serological reaction carried out in the case of atypical localization. Prevention, personal prevention, boiling water, public prevention, identification, the treatment of patients, improvements of reservoirs, requirement of separate source of drinking water from where water intake is possible without immersion in water, destruction of cyclops in open reserves with zinc, dimethyl discarbamate, sanitary and educational work. Brankov's filamentous plant, Bucheria brankovti, is a causative agent of Burcheriasis. The matter individual is filamentous, milky white in color. Females are 8 or 10 centimeters long. Males are 2 and 5 or 4 centimeters long. The tail end of the males is rounded of the ventral side. Viviparous larvae are colonies 0.2 or 0.3 millimeter long. One colon, according to Romanovsky Jimsa, it is clear that a larva is covered with a pink cover. The nuclei of somatic cells at the end of the body are not detected. The curves of the body of the larva are correct. The tail is straight, gradually tapering. Burkheria is biohelmet. The ultimate host is a human. The intermediate host and specific vector mosquitoes of the genus Aedes, Anopheles, and Curus. Localization in the body of the final host. In a lymphatic system, females give birth to microfilaria which enter the bloodstream from the lymphatic system and are swallowed by mosquitoes with blood. The nocturnal periodicity or larva appearance in the peripheral blood in characteristic of Urcaria, which is associated with the biology of the vector. The maximum number of larvae is determined from 22 hours to 4 a.m. In the daytime, microfilaria are located in the capillaries of internal organs and large arteries. On the instance of Polynesia, Branchos filamentous microfilaria are found in the blood constantly, with a low daily peak, a diurnal subperiodic type of migration. This is obviously due to the biology of the Aedes Polynesian a mosquito which is common there and which feeds during the day. In the stomach of the mosquito, microfilaria are released from the cover actively penetrate the chest muscles. There they molt twice, grow, then go out into the body cavity of the mosquito and accumulate in the terminal lobulus of the lower lip. The duration of larva development is the average 10 or 20 days up to 6 weeks. And depends on the type of mosquito, atmospheric temperature, humidity. Human infection occurs when a mosquito bites. The invasive stage is the larva. The larva remain on the human skin near the bite site, then actively penetrate through the skin into the lymphatic system, where they reach sexual maturity in 5 or 80 months and begin to give birth to microfilaria. The lifespan in the host body is up to 20 years. Pathogenic effect, toxic of allergic and allergic, mechanical damage to the walls of lymphatic vessels, secondary infection attachment, blockage of the lymphatic vessels, leading to lymphostasis with a gradual development of uh, elephantiasis. Clinical diagnostics is fever, lymphadenitis, elephantiasis. Laboratory diagnostics is detection of larvoscopy in native or Romanovsky Gimsa, stained smears and thick drop or blood. Blood sampling should be carried out at night. If a subperiodic strain is suspected, then at night and during the May and detection of adult filaria, helmintoscopy, in the biopsy of the affected lymph nodes and serological methods. Prevention. Personal prevention is protection from mosquito bites with repellents nets on the windows. Public prevention. Identification and treatment of patients, control of mosquitoes and their larvae with pesticides, agrotechnical measures for improving the area, sanitary and educational work.